Good evening, my name is Andrew. Today I'll be educating you on diabetes. So, when we talk about diabetes, we have two types. We have diabetes mellitus, which is a common one we all know, and we have the diabetes insipidus. With the diabetes insipidus, the individual produces voluminous amount of urine, which is very dilute, and the individual is unable to concentrate salt within the urine. The most popular one that we know, we have the diabetes mellitus, and that we have type 1 and then type 2. So type 1 individuals, usually it can be juvenile onset, okay, right from birth, as a result of certain diseases, viral diseases, and autoimmune diseases. They can result in permanent distraction of the pancreas, which wouldn't let them be able to produce any amount of insulin. So what they have to do now is to take insulin exogenously. Okay, so we have various types of insulin. We have long acting, intermediate, short acting. Okay, and with the type 2 diabetes, it's usually develop. That one is what we term as insulin resistance, and it's usually developed as one ages, probably due to certain dietary habits, sedentary lifestyle, and certain practices, which makes the cells in the body resistant to resistant to insulin. Okay, so with this we usually use pharmacological agents, but initially, what we do is that we start with non-pharmacological therapy, and when this doesn't help, then we change it to pharmacological therapy, or sometimes we do both. Okay, so usually the first line of drug which is given is metformin. Okay, if metformin is unable to adequately control um, the individual sugar levels, then we may have to find another agent to add to. So we can have the insulin secretagogues. We can, for example, gliclazide, glimepiride, and the likes. We can add them. We also have the DPP4 dipeptidase 4 inhibitors enzyme, vildagliptin, and the rest can be added to the patient's therapy. You can have the sodium glucose cotransporter 2 inhibitors also being added. Okay, so it's always important to check whatever you eat, whatever you put into your body will determine almost everything, your lifespan, and many other things are affected by that. So you have to do well to feed on good things. Okay, so yes, that is diabetes for you. So now let's talk about normal levels. We have two units. We have a millimole per liter and then the milligram per deciliter. These are the two units that are used worldwide. Okay, so if you have one unit, you can convert to the other. You can convert to the other unit. Okay, so for example, if you measure in millimole per liter, you want to convert to milligram per deciliter. What you have to do is to multiply by 18, and in the other way around you divide. Okay, so we have fasting blood sugar levels and the random blood sugar level, same as preprandial and the postprandial glucose. Okay, so with the preprandial, usually 8 hours or more after your last meal. Okay, so usually this value has to be within, let's say, 3.7 to 5.5. Okay, it should be less than 100 milligram per deciliter. Okay, and for the postprandial, we usually measure 2 hours postprandial, and with that, the usual range for an individual with diabetes should be 7.8 millimole per liter or less. Okay, however, in individuals with diabetes, the value usually is higher than that, and you should, however, it shouldn't be more than 8.5 millimole per liter. Okay, so you have to be checking some of these things. Okay, you can also do the hemoglobin A1C, which measures the amount of sugar attached to the red blood cells within a period of 3 months. You know that red blood cells usually have a lifespan of 90 to 120 days. So within this period, the amount of sugar that is um, attached to the red blood cell is measured. It's also a good and accurate way of determining whether an individual has diabetes or not. So thank you very much for your audience. Have a nice day. Bye bye.